If you're having pain in your sternoclavicular joint, which is where the collarbone joins with the chest bone, and this is impacting your shoulder range of motion, this video has a doctor's best exercises to fix you in matters of weeks. Stay tuned. Disclaimer: this video is for information purposes only. This video is a telehealth call I had with Dr. David, who assessed my situation and my situation only, and should not be seen as medical advice. Please seek professional help if you are in pain. I'm super fired up today as I welcome Dr. David from the El Paso Manual Physical Therapy in El Paso, Texas, to assess my current pec tear and SC joint strength. He shares with us his best mobilization techniques on the SC joint that will ultimately help you with your shoulder rehabilitation. So let's have a look at the telehealth appointment I had with Dr. David.
So tell me a bit about what happened. How did you hurt yourself? How long ago did it happen? And what is it like today?
I was training for about 5 weeks. Yeah, for about 5 weeks, this gymnastics skill called the back lever. On the week number 6, I was doing 5 sets of 15 seconds hold. And on set number 3, and then I just felt this kind of a zipping sensation on my left back. The pain was not just the back, but also some weird pain right in more or less the clavicle to sternum around this area. I didn't know what it was.
Okay, I got a few more questions. I think I know what's going on. I just have to rule out a few things and rule in a few things. In that position, you said you were doing the one with your face down. Is that where you got hurt?
Yeah.
You were getting stretched backwards this way with your arms, right?
Yeah.
When your arm goes back that direction, even without any sort of tension, you're pulling everything away from your body. All the tissues here are getting stretched outwards from the center of your body.
Right.
The only physical joint, like bone to bone connection of the entire upper arm to the spine is through the collarbone. The shoulder blade is just floating in muscle. It doesn't directly connect to the skeleton itself. The shoulder blade connects to the collarbone connects to the sternum right here. So it makes sense that that's what you strain there. You probably sprain the joint, strain, kind of the same thing, just depends on what tissue it is. Now let's just diagnose this a bit more. So your shoulders have the ability to shrug up and down, of course. They can also roll forward and then they can squeeze backwards. So real slowly roll your shoulders forward like you're gonna hunch. Let me show you from the side. When you do that, does it feel okay on the joint right there, or does it bother you?
I can feel a very, very faint pain right now. Not crazy.
What I'm expecting you to feel is like a crunch or a stiffness, like it doesn't go as good as the other side. The opposite, pinch your shoulder blades back, that's retraction.
Yeah, I feel much more now. I feel more now.
That's
by
worse.
really pulling back, I can feel more here on the SC joint.
Okay. So what you need, absolutely need, vital, is that joint needs to be wiggled. That's called the sternoclavicular joint. It's where the collarbone meets the sternum, the SC joint for short. And it has a good amount of wiggle in it, and you're gonna have to move it on your own. It sounds like going backwards is the one that is probably most stuck, and probably reaching up because you're having trouble reaching up this way, right? With injuries like this, it's very common to sprain the muscle, to injure the muscle or the tendon, and that just takes some time to recover from. And if you don't do anything as far as like going back to the activity that hurts you, it should heal. It's just like if you cut your skin, if you baby it, put a Band-Aid on it and let it scab over and go through its normal process, it should heal. But in the case of muscles, they move joints. And if the joint isn't moving 100%, then you're going to have this residual discomfort or pain like you're having. Like now you're like, oh, it feels a lot better. I can move much better than before because the muscles are letting you move, but you still have some limitations because the joints aren't 100%. Right now, the snapshot of your current condition, it's now the joints. And if you don't get that joint happy again, getting back to full speed activity is not going to happen very smoothly. So I need you to get a pincer grip like this. Or a key grip is another one. Yep, just thumb near your index finger. And what you're going to do is put your collarbone, your SC joint, the bulky part of your collarbone right there. Watch. Yeah, right there. You might have to toy around with using your other hand, see which one works better. But let me show you how this works. So there's my collarbone right there.
Mm-hmm.
There's the end of it right there.
Yep. Yep.
So I'm gonna put my pincer right on the ball. It feels like a lump or a ball right there. That's what I want. So there's the collarbone, and there's where it attaches to the sternum. This is the sternum. So you're gonna be
Mhm.
right on the apex right there. Key grip
Gotcha.
or pincer grip, and you're gonna push on that bone as you move your shoulder blade forward and back and up and down. All right, so like that, right there. And then you're gonna push with your other hand on it. So you should feel some pressure under your fingers and onto your collarbone. And it's not comfortable. It's not terribly uncomfortable either. It shouldn't be making you cringe or hold that as much pressure as you can tolerate without tightening up. And then as you hold that pressure, shrug up and down. You know, I'm showing a full shrug, but if at 50% you start to feel discomfort, only go 50%. And we're going to do 30 reps like that. About, you know, I'm trying to do this for about a couple of minutes at most. And you have to maintain that pressure. So if you need to take a little break every now and then from your hand or the pressure, that's fine.
Yeah. Mhm.
Now I'm going to have you do the same pressure. See, I'm all red from the pressure right there. And you're going to retract and protract. If you need to switch hands, if you find that it's better to push with your right hand on your left sternum and your left SC joint, that's fine.
Yeah.
Whatever you feel like you need to do here. So just forward and back and forward and back. And if you're real high like this and it's painful, it might be better to just kind of sink down into a comfortable position. But honestly, the higher you can retract and protract, the better the motion's going to happen at the joints.
Yeah, and I do on this one here when I retract right on the apex, I feel I feel the pop. There's a pop going on.
Is it repeatable? Like, does it happen every single time?
Yep.
Okay.
Yeah. Just by doing this little retraction here, I got a pop.
Okay, let's stop that one then. Because if you have a pop that's just a one-time pop, even though you keep doing the same movement, that's not too big of a concern. You probably unstuck a stuck joint. So it's a good thing in that case. But if you have a repeatable click every single time you do the motion or every other time, then you're likely going to have loose ligaments around the joints, and you need to work on the strength more so. Let's do one more.
Don't do this one.
Stop for now. Let me do one more mobilization with you here. We call these joint mobilizations. This one's probably the most uncomfortable one. You're going to have to hook your fingers, bring them all close together like this, and then you're going to grab, not at the apex, but a little more to the side where you have the shaft of the bone, the long part of the bone. And you're going to have to dig in just a bit. You can't dig in much. It's going to be very uncomfortable, but you're just trying to dig in enough to grab the edge of the collarbone just a teeny bit. And then you're going to be pulling the collarbone forward as you retract and protract. This one's a little more challenging to do. It's not very comfortable, and just about 30 reps. This is manual therapy. This is not what every PT is trained, physiotherapist is trained to do in physiotherapy school or physical therapy schools, we call it over here. Here's what you got to do next. I need you to maximally fire your upper traps. And the way I want you to do this, watch me first. Upper traps fire when you shrug all the way up like this, and you have to maintain a little bit of a double chin. So when everybody knows how to make a double chin, right? This goofy position. But when you do that, you fire some muscles that are behind your throat, and they help to stabilize your neck bones, your cervical spine. And those neck bones are really important to have stable whenever you're firing your upper traps, because the upper traps attach to your neck bones, and they use them as like a foundation to work from. So if you don't have these muscles firing on the front of the neck, your double chin muscles, it's not going to work very well for your upper traps. So do a little baby double chin, like 25%. Not if this is 100%, then just back off to that's 25% for me. It's just this is not firing. That's 25%. Perfect. And you're going to see when you shrug, your head's going to want to leave this position. Your head's going to want to go, ugh. And you have to work a little harder to keep it in the same position. Okay. So now holding your neck in position, start to reach up, and with your left side, only go up to the point where you feel a little bit of discomfort.
Okay.
And then you're
Okay.
going to shrug from there. Okay, so
So
you're
this-
reaching up, keeping your chin in, and then make sure you're shrugging, and you're trying to get to as close to 100%, but if you got to be like this, that's okay.
That's about it. I mean, I
Okay.
can go here, but
Bring your
because
right
I already.
bring your right one up and watch the space between my ears and
Mhm.
my shoulders. I'm trying to close that space, not have a gap. like
Yes. Yeah.
Okay?
Okay.
Put your hands about right here, about face level. So without reaching up, you're going to shrug now. Yeah, that's
Yep.
better.
Mm.
Okay. Are you all the way up at this point?
All right. Now I am. Yes.
Okay. Now go up a notch more, like all the way up as high as you can. Hold it there for 10 seconds, Felipe. Relax. Okay, we're gonna do this 10 times, and each time I want you to test to see if you can go up a bit higher. So your hands are about head level right here. Let's see if you can get them just a few inches higher. Right there, all the way up, all the way up. Big shrug. Ideally, no pain, or
No
just a
pain.
teeny
No
bit. And what I
No.
would love is for you to shrug all the way up. You should feel these upper
Yeah.
traps working very hard.
Fire.
Good.
Yeah. Oof. Yes.
Great.
No pain. No pain. That was good.
Fantastic.
Oh,
Keep your neck
just gotta
position.
pop
Look
down.
good. A little pop on the way down.
Yeah. Yeah.
As long as there's no lingering pain from the pop, it's fine. It's just the
Mm.
joint shifting likely. Thing that we did here with the joint, so we did it in 3 ways. You had your key grip and you were pushing as you were shrugging, 30 reps, and then you were pushing as you were going forward and back, retraction and protraction with the shoulder blade, 30 reps, and then you were gripping and same thing, retraction, protraction, 30
Yeah.
reps. Those should take you a few minutes at most, maybe 5 minutes. I want you to do that 3 times a day right now.
Right. Okay.
You only need to do that one until your motion frees up 100% cold. So in other words, like right now you've warmed up, but let's say 8 hours go by, 10 hours, a full day goes by, and you haven't been doing anything physically active. You've been at the computer, you've just been sitting still for a while. If you're to reach up at that point and you're like, you don't have your full range of motion cold. I'd love for you to be sitting, not having done anything, and then be like, oh, I didn't even warm up and I got my motion. Once you hit that milestone, you're done with this exercise, with this stretch, joint mobilization thing. Does
Right.
that make sense?
Okay. Yeah, it does. Okay.
You should
Okay.
feel like you're getting stable with this exercise too. So this one, I want you to do in addition, right after you do the stretches, just like we did today. Do your shrugs and work on getting higher. You can start from a high position as long as you don't have any pain, but that's the key here is you want the muscle to work as hard as possible without any pain coming on, or a smidge of pain is all I'd like, but nothing more than that.
Warming up and stretching your shoulders before and after your workouts are the best way to avoid injuries. So on screen right now, you can see my follow along shoulder mobility and strengthening routine. So if you need a quick routine to maintain your shoulders healthy, come and meet me in the next video.